Are you able to manage your time? And if you are, you have the upper hand. But what if you're not? And what if you're overwhelmed and no one really can even appreciate what someone has going on outside the hospital?
In the most superficial sense, it's really important, even if you don't feel comfortable going to your program, to find someone that you can kind of confide in and discuss that with, whether that's a family member, whether that's a co-resident or co-fellow, or even just a friend from your non-medical life. I think that's really important to just have someone that you can commiserate with.
Welcome to Candid Minds with Dr. T. I'm Dr. Tamir Aldad, addiction psychiatrist and CEO of Mindful Care, the first ever psychiatric urgent care committed to providing affordable and accessible mental health care. Hello, everyone, and thanks for joining us again here today. We're discussing burnout, particularly navigating burnout in medical training. And it's important to recognize this topic as we've experienced an epidemic. We have healthcare professionals that are going above and beyond every day. And a lot of times their effort and hard work is taken for granted. And what's important is to spend some time discussing what does it really mean to go through medical training? What is the mental health impact of going through medical training? How can we be more supportive and encouraging of these rising stars and talents working very hard to serve our communities? And what could we do to make sure that they're successful? And exploring, are there things that need to be changed in the system to help them thrive? So I'm excited to explore this topic. We also have a great guest with us today that I'll share with you in a little bit. So lots of great stuff planned for you. A little bit of background. As you guys know, I'm an addiction psychiatrist by training. And after residency and fellowship, I started a mental health company at a national scale, but spent a lot of time reflecting on what it was like being a physician in training and going through medical school. And at the time, I was also trying to start a family, and there was a lot going on. And as much as I had people surrounding me, it also felt very alone. And that's why I wanted to spend some time discussing this topic, because I don't think it's given enough airtime. So some of you may know you go through 4 years of college. After college, you go through 4 years of medical school. Then you have residency, which could be anywhere from 3 to 7 years. Then you could do fellowship after that. So it is a very, very long journey. You're looking at putting in 12 hours a day, 6 days a week, tons of patients, navigating the dynamics of a hospital, which is challenging between all the support staff that you have and bureaucracy. Starting your day early, staying late, right? So it is the system by design is very difficult and taxing emotionally, physically, and you're really left to your own solutions to figure out how to cope and how to make sure you can extend your runway. And what does that runway really look like? Are you able to manage your time? And if you are, you have the upper hand. Or what if you're not? And what if you're overwhelmed and no one really can even appreciate what someone has going on outside the hospital? It's assumed everyone is very resilient, has no personal problems, doesn't have family issues. And you're supposed to paint a very perfect picture when you come into work, right? But let's be realistic. Everyone does have issues outside the hospital. So I think what I want to bring to light, or at least spend some time recognizing, is how difficult it is to make it through medical training. And are we doing a good enough job supporting young medical students and doctors through the process? So for me, it was challenging. I'll admit it. I was commuting about an hour each way every day, which was difficult. And like I said, I was trying to grow a family simultaneously. So it wasn't easy. And when we decided to discuss this topic, we pulled some statistics and found that a meta-analysis showed about 35 to 40% of individuals going through healthcare training experience some sort of burnout. And I'm not surprised. I think that I would have wanted the number to be lower, but when you look around the hospital, you see it. You see it in people's eyes. You see how they're running out of steam. So certainly, certainly makes sense. And another topic that we're going to also discuss is, are there things that should be changed? Does it make sense to continue having young training physicians work long hours, perform surgery when they've not slept or they've been on call? Are there protective measures? Are the protective measures that are already in place really effective? There are ways that we try to protect these young physicians, but it's questionable if we're adhering to them as religiously as we should, right? Everyone wants to impress their boss. Everyone wants to go above and beyond. It would be unusual to quote some sort of regulation that you're not allowed to participate in some sort of surgery. Uh, it's also not considered very professional if you do. So there's a stigma around the person who might want to do that, right? So we'll navigate that a little bit today as well. But really excited to talk about this topic as I think it's important and doesn't get enough airtime. So look forward to today's conversation. Hey, it's Dr. A, the psych intern. I have a consult.
Okay, sure.
Bed 231. She has a rash on her anterior left thigh.
So what does it look like?
Macular, papular, maybe a bit erythematous.
Can you give me a little bit better description?
I don't know, it's just really red. I would say macular.
Okay.
Just come take a look.
Okay, fine.
Also, bed 240. I called medicine 4 hours ago for a consult, and no one showed up. And he's still constipated, hasn't had a BM in 2 days.
Sorry, we've been pretty slammed here. What have you given him so far?
So far, I gave Docusate 3 times, gave Dulcolax, nothing. Can you guys just come disimpact him?
Disimpact him?
So the next option is I'm just going to call GI and have them do a colonoscopy.
Dear God, no. Please, let me just see him first.
Perfect. Last thing, Miss Johnson, bed 238. Her ear is still bothering her. I'm suspecting otitis media.
And how does the ear look?
I have no clue. They don't give us otoscopes.
Oh boy.
I need that treated stat.
All right.
Do you remember our collab on TikTok?
Of course, I remember it very well. I think it was the first collab that I did, and
Yeah,
it set off
it was my
string of them because then people saw that and they started reaching out to me asking to do the same. And
so
then
it was my first as well. And then what happened is a bunch of psychiatry residents across the US started pinging people in my program saying, "Isn't that one of your residents?" And then it just took off. It performed pretty well. I mean, you have tons, but I didn't have that many at the time, and I haven't really kept up with it since then. But yeah, it was pretty cool how it took off, and random people started messaging me and saying that they saw me on their TikTok, and it was pretty exciting. All right, Dr. Ben Schmidt, thank you very much for joining us. We're excited to have you on our program.
Thank you.
We just finished a discussion about burnout and medical training and how important it is to find an outlet. And you and I have worked together on some Tic Tac collabs in the past. So we'll reference that a little bit. And I'd love to share with our audience what that experience was like. And we'd love to hear from you a little bit how you found comedy and skit making helpful and what that meant for you in your training. Certainly looks like it was a therapeutic outlet, but would love to dive a little bit into that. So welcome to the show. Share with us a little bit about your background.
Sure, absolutely. Well, thank you so much for having me. But yeah, my name is Ben Schmidt. I'm a GI physician. But on the side, I also have kind of a social media alter ego, I guess you could say. Doc Schmidt is the name that I make social media content under that I've been doing that for about 3.5 years now, where I started when I was a GI fellow, making videos, making skits that were both educational, but also kind of humorous in tone, poking fun at a lot of different aspects of the healthcare experience, be that the patient experience, the medical student experience, the GI fellow experience, which is what I was kind of actively experiencing at the time, and then just kind of the oddities of healthcare. And it's something that a lot of people could relate to, I found over time, and it took off. And now I am 3 years later with over 1 million followers across 5 platforms, and it's admittedly been a little bit crazy. So yeah, I've been come a long way since our first collab back in, I think that was probably about 3 years ago at this point.
Yeah, absolutely. I remember it. I remember when I first started on TikTok, and I came across your work, and you were really producing clever content that was it was just fun to watch and really relatable as someone who was going through training and experiencing a lot of the highlights that you were able to identify and like nuances in training that we don't appreciate. You really brought them to light. So it was a great time, and it really picked up after we did that. A lot of psych residents reached out to people in my program and said, we saw you on TikTok, and then they referenced you and how impressed they are with your work. So looking back, you've certainly come a long way, which is incredible, and it's an honor to have you on our program today. But yeah, it's also fun to reflect on that a little bit. I'm curious, when you first started, how did you feel it impacted you in terms of where you were with self-care, residency and fellowship, we know are exhausting, they're taxing. Uh, how did you find that this is a helpful outlet for you? And when you discovered that, how did you double down on that and really explore it further?
Sure. I think I was a little bit of a unique case, but in general, I know a lot of people had been exploring TikTok and social media much deeper than they had prior because of the pandemic, which I think was contributing to a lot of burnout among healthcare workers and healthcare trainees in particular. The reason I said that I was a little bit unique is that I have some experience making videos, even from before I was a physician, even as a high schooler and a college student. I would make kind of silly little skits like this, but obviously not with a medical context because I wasn't in the medical field. So I always kind of used skit making and video making as a little bit of an escape. But I found that it was a nice marriage of the two aspects of my life at the time, this kind of escape of video creating and skit making with the healthcare theme to it. And I think that it was a great escape for me because I was able to sort of reflect at a distance, I guess, from the difficult experiences that I had. It took me a little bit of time to find my niche in terms of exactly what types of videos were the most fulfilling. But at its core, it's something that you can really kind of, shut your doctor brain off for a little bit and focus a different part of your brain on. When I say like kind of coming up with skit ideas and then writing out a little script, filming that and then editing that, I can really kind of get inside my own head sometimes when I'm overly focused on, the patients that I'm taking care of and the difficult situations that face me the following day. But when I'm focus on a specific task that I really enjoy, like video editing or video creation, it's something that allows me to forget about the more stressful elements. And then I think kind of separately, because it was healthcare content, some people might think it's strange that I'm escaping by still continuing to talk about medicine in video form. But I think for me, it was a way to maybe process some of the stressful thoughts, especially in the time of kind of COVID still being very prominent at the time that I was doing this. Was October of 2020 when I first was making these videos. So for me, it was a way that I could kind of show the struggles that a lot of people are going through. And then initially that was just a way for me to vent, I think, but then it started becoming a way where I could see that a lot of other people who were finding my content were having a similar experience, even across the world. I had people from Africa, from Asia, from Europe, all voicing similar concerns and experiences. So that was really beneficial for me as kind of a secondary gain. That's of course not initially why I started it, but to hear these kind of similar sympathetic stories was really helpful for me.
Yeah, I think that that reinforces it, and there's something very rewarding when you're seeing you're having a positive impact on people, and they're able to identify with you, and you're helping them in that sense. But you talked a lot about escape, and I want to hear a little bit more as to what that really means, particularly how you felt uh, before going into creating something after a day's work, after seeing a bunch of patients, and then after you get to disconnect, unplug, you produce this skit. What was the positive impact before and after? And how did that impact you?
Yeah, I think escape is maybe a strong word, but I think it's an important concept in being able to sort of separate yourself from the stressful work environments that you may be experiencing. I think escape is now harder than ever in healthcare because we're so connected to our jobs still, in the sense of, we can have the electronic medical record on our phone. We can check in and see, how that patient is doing, or if you can't remember if you ordered that lab, you can check those things. So that would be something that would weigh on me a lot. So I'm personally a big proponent of trying to have time where you can completely disconnect. And in order to do that, I think you need to have something to disconnect to. And sometimes it's not enough just to, watch a show or watch a movie. I think it's easier for me, at least, to disconnect, being more active, doing an active task like creating a video or editing a video. And for me, it had such a hugely beneficial impact on my mental health because I could sort of actually have a recharging time where I have these hours between getting home from work and going to bed where I'm not focusing on that work task. And then I feel like the next morning when I'm going in for work, I don't feel like that was the most recent thing that I was doing. So having these different components to your evening are really important. And that started to be what it became, making these videos. I would make a video pretty much every night, and I would just spend an hour doing that, and that would be a nice escape. Whereas before, I might have spent that hour passively watching TV and kind of in the back of my mind thinking, oh, what am I going to do with this patient with this infection? We can't figure out what it's from, or how are we going to manage this, cardiac issue that this patient has, or how am I going to deal with this GI bleed that's going to be probably coming in tomorrow? But instead, I can kind of separate myself from those thoughts a little bit, and then that, I think, is a very important way to move forward and to approach a problem maybe even better than you would otherwise. Because I don't think perseverating on these problems has a beneficial impact, certainly not on the mental health, but even on the way you address that situation the next day.
For sure. And I think residents and fellows spend a lot of time perseverating, and it actually it compounds, and it makes it worse. And as you try to make it better and think, you dwell on it, and you really it becomes more and more taxing. And you mentioned time, which is so precious to someone in their medical training, and feels so limited. And time management is huge, especially when it comes to mental health and wellness and self care. Now, I'm curious. It sounds like you had it down in the beginning, where you had your training, and then you come home and then you spend some time. Now, having over 1 million followers across 5 platforms, are you at risk of things turning kind of the other way, where you're spending too much time on making skits and comedy, and now it's a juggling act between building your persona online and being a prominent physician?
Absolutely. It's funny that you say that, because this balancing act is something that I guess I assumed I would get better at with time, but I think that it's become almost more of a struggle over time in terms of finding the right balance of being a physician and being a content creator. And that's in part because I think when you start something, you have more the enthusiasm behind just the hobby of it all, and the activity of it, and the distraction element of it too, to a certain degree. So for me, I've become busier also in other ways, because for instance, I have a 2-year-old daughter now, and I did not have a 2-year-old daughter when I started doing all of this. But as well, for me, it has become something where I need to make sure that I'm not, kind of like you alluded to, flipping the script and now almost becoming burnt out from making content. I think that's something that people, whether they're in healthcare or not, people who make content for social media often fall into that trap, because social media demands content, right? Even if you make the best piece of content you've ever made, if you don't post anything in your normal cycle of posting, after that, you're going to start becoming obsolete. And I think that's a stressful element for this particular hobby that I picked. Obviously, most hobbies are not like that. But yeah, for me, it's about trying to find that balance where I'm not suddenly becoming burnt out from my hobby, ironically. So I've developed ways to work towards that, because I think that again defeats the purpose of even having this escape, or this hobby, where now I kind of devote specific days or specific time periods to making video content, and make sure that I have ample time for my family, and then of course for my job as well. I think that for me in particular, picking my job, because as I said, I was a trainee, a GI fellow when this all started, my social media career, and I transitioned to a attending physician. And I think that I actually had to keep that in mind when I was picking it, and making sure that I found a group that I could join where my time would be very precious, understandably, and something that I can have more control over.
Did you ever feel that your hobby and this work as a content creator negatively impacted or jeopardized your role as a physician or an
No,
attending?
no, I would not say it ever. I think if anything, being a content creator while being a physician benefited me a lot, because I think it made me a lot more introspective. Kind of selfishly, I'm always looking for content, looking for things to discuss. But I think that what that turned into is really kind of analyzing situations that I'm in deeper than I would otherwise, because I'm trying to make a skit that kind of highlights what this maybe episode that I witnessed really says about the healthcare system. I've changed a lot in terms of, complaining is a big thing that we love to do in healthcare, where we might, complain about what someone else has done, or why our job is hard, or why this or that. And I think that a lot of that complaining, I've been able to turn that into a video or a skit idea where I can explain something a little bit deeper, or help people see a typically annoying situation a little bit better. So I think in that sense, it helped me be more aware of both my job, but also the people around me, the nurses around me, the respiratory therapists, and the pharmacists, in terms of like literally professionally, where if you mean like, people not liking that I'm doing social media. I've really been lucky in that the fellowship program that I was in at St. Louis University was very supportive of that when I started, and the job I have now with ESSA Health here in St. Louis, Missouri, they're incredibly supportive, and I'm actually working with them separately to make some content for them and for the practice as well, to both educate about colon cancer and GI topics, but also about ESSA Health itself. So it's been a good marriage in that sense too.
Yeah, I think one skill that you've developed over time is becoming hyper aware of dynamics in training and recognizing that a lot of times we take it for granted or we're too busy to even recognize it, and being hyper aware and calling it out, and then presenting it through a medium where it's reflected back, it's mirrored back to you, or to the people that it impacts, is actually really interesting, and could, I know at face value it's meant to be comedy, but it could also have a positive impact on changing things, particularly if you highlight issues within the system that are broken. It's difficult to appreciate when you are moving so quickly, trying to treat as many patients as possible, as safely as possible. When somebody takes a second to mirror that back to you, you suddenly realize that there are things that we do that are kind of ridiculous. And you've developed a really good skill at recognizing that, and then I think tastefully presenting that back, right? Which is awesome. Any advice that you would give to residents and fellows in their training that feel as though they're burning out and might not feel comfortable going to their program director, aren't sure exactly how to cope, but recognize that they're exhausted and want an outlet?
Absolutely. I mean, I think in the most superficial sense, it's really important, even if you don't feel comfortable going to your program, to find someone that you can kind of confide in and discuss that with, whether that's a family member, whether that's a co-resident or co-fellow, or even just a friend from your non-medical life. I think that's really important, to just have someone that you can commiserate with. I definitely had that in my situation, but I just had the added benefit of finding a hobby where I could kind of do that on a mass scale, I guess you could say.
Yeah, I mean, I think commiserating as a resident, we have that down. I mean, that's
exactly. That's a requirement.
Certainly, for sure.
But yeah, and then I think that it is really important to find something that can be an escape for you. I think that is a good word. I think that some people might hear that and think that we must hate our jobs if we're escaping it. But I don't think that's true. I think that it's important to have different sections of your life, and obviously what I chose as my escape is a very specific thing that isn't going to be for everybody for many different reasons. But I also am not limited to that escape either. I think sports are a really important escape, just exercise in general. For me, I play racquetball and ultimate frisbee and tennis, which are really helpful for me. Again, something where I will play, one of those sports for an hour, and then I realize I haven't thought about anything stressful in my life for the past hour. It can really just separate yourself from that. And I alluded to the fact of TV and movies being maybe passive ways to escape, and I think that's okay for some people. So that can be a simple one where you can just escape in the world of whatever you're watching. But I would urge those people, after kind of discussing things and making sure that they're able to communicate what their concerns are to someone in their life. I think working towards finding out what is hugely important and can make a huge difference. It doesn't have to be some huge time commitment. You don't have to go rock climbing somewhere that's 2 hours away from where you are and dedicate half a day to it. It could be something as simple as taking a walk for 15, 20 minutes after work, and that can be your complete separation from where you are. It can be very simple, and then you can, if you want, you can build from there, or you can keep it as simple as you'd like.
Absolutely. Well said. Dr. Ben Schmidt, thank you very, very much for joining us. I appreciated your insight, and thank you for also being a good friend and keeping in touch. I salute you for the work that you're doing. Wish you a lot of success. I'm excited to see what content you continue producing. Of course, if we could be supportive in any way, feel free to reach out. But it was a pleasure having you on the show, and I appreciate you giving us some of your time.
Absolutely. Thank you so much for having me. I appreciate the conversation.
It's much easier to prevent burnout than it is to treat burnout, right? It's the idea of being proactive and preventative than being reactive. And once this already sets in for a clinician or a resident or a fellow, it becomes very, very difficult to undo and requires a lot of effort. So if we could be wise and strategic in the way we prevent our healthcare professionals from burning out, it'll be advantageous for all of us. And there are many positive coping skills and strategies that students and training physicians can use to increase their resilience and reduce their likelihood of developing burnout and burnout type symptoms. The most important one is to prioritize self care. And it's easier said than done, but it requires someone to take breaks, schedule real downtime, unplug, even unplugging digitally. Right now, the fact that you can go home and still see a patient's medical records, still have access to their labs, you're tempted to call the hospital and see how patients are doing. You really need to fight that urge because really unplugging means unplugging all the way. Building a physical exercise routine is very important. Having some sort of outlet and doing something you enjoy. It could be a sport, could be going to the gym, could be going for walks. Prioritizing cooking real meals and eating healthy food. A lot of times, as physicians, we don't practice what we preach. You'll talk about eating healthy and teaching your patients how important it is to have a balanced diet, and then you'll end up going to have graham crackers from the emergency room because that's all you could eat in between seeing patients. Make sure your sleep is balanced and adequate. You're sleeping enough hours. At the end of the day, it's difficult to prioritize sleep. It seems to be the best place to get more hours back in your day. But what happens is that compounds, and a cumulative loss of sleep over time has significant mental health consequences. And setting boundaries is very important. And boundaries doesn't mean that you have to be hostile or unprofessional or rude or obnoxious, but it's important being vocal about your limits. And if you feel overworked or you feel like something is not your responsibility, saying so. And a lot of times people juxtapose boundary setting with being a team player. And there's a difference. You could still be very much a team player, but also make it very clear that this is the extent to which you hope to participate and support your colleagues and your friends at work. But this is where you're drawing the line. And it's really important to protect yourself to make sure you can continue producing high quality work day in and day out moving forward. Social support is also an interesting point because a lot of times people don't leverage what is a strong support system. Granted, if someone doesn't have one, it is much more challenging. But those that do have a strong support system, tapping into that support system is huge. Friends, family can all support a resident or fellow through the process and should really be a part of the process and educated along the way with shared experiences so they know what you're going through and can lend a shoulder however possible. And ultimately, if somebody really feels that these resources aren't enough and these measures aren't enough, seeking professional mentorship is huge. If there's someone in the hospital that you work with that's above you, communicating with that person and seeing how they coped going through the same program and the same type of stress, there's a lot you can leverage there in terms of wisdom and knowledge and expertise, and see if it's applicable to you as a resident or a fellow. Regarding the boundaries, I do want to acknowledge that setting boundaries and seeking support could be difficult. The culture in medical schools and hospitals often encourages and rewards putting in extra hours and going above and beyond. I've been there. I know that. And it becomes very awkward and uncomfortable if all your peers are doing far more than is expected of them and you, for some reason, aren't able to perform at that level. And it could be very appropriate for you. Nobody knows what you're going through outside. And we have medical professionals that have families, have children. Some have their own health issues that they're dealing with simultaneously while going through training. They can have ill parents, loved ones. They could be caretakers for people, right? So it's difficult to appreciate what's going on. And then when you compare everyone and try to level the playing field, it's unfair to the person who isn't starting from the same place everyone else is. So I acknowledge that, but I think it's important to find the courage to share what it is you're experiencing what you're experiencing outside of work, and bringing that to your supervisor or your program director or whomever. And we need to create an environment in the hospital where it's okay to do that, right? Medical professionals tend to think that they have to be the most resilient people in the building. And it's okay to admit that sometimes it's difficult, right? And recognizing that it's only human. So creating an environment where that's encouraged, I think it is very, very important and must happen, or else we're going to lose very talented doctors. Long term, prioritizing your well being and building a sustainable work life balance will make you a better and more successful physician. But I think it's important to recognize that this doesn't just apply to healthcare professionals. The ideas I'm talking about apply to anyone early on in their career. That whole period where you're training, learning the ropes, you're the quote unquote rookie. These are important boundaries that should be set and perspectives that a young training individual should have to protect their mental health and their well being overall. In healthcare, as a field, we really should want to train doctors who are resilient and capable and who will be happy to remain in the field for years, even for decades. And it's dangerous to think that we're going to work them as hard as possible and think that nothing will happen. There won't be any downstream negative consequences, when in reality, if we don't prepare them to be successful, it might be a short term gain, but a long term loss. So it's important to keep that in mind. High level, I also think there needs to be institutional changes, right? And cultural changes that are set and focused on reducing a lot of the burnout. And many healthcare institutions are already doing this. They're working to address and prevent burnout by having wellness programs. Staff are offered fitness classes, mindfulness training, nutritional classes. Mental health and therapy services are now available to staff. So we are seeing a trend in this direction. And the purpose of today's discussion is just to highlight that even more, right? Emphasize that even more and push people to do even more. It's great that we're starting, but staying aggressive is really important here if we want to see the needle move. So proactively offering mental health support does reduce the stigma associated with seeking help. It is being talked about in hospital. Doctors, nurses, other ancillary staff are aware that mental health is important, and these resources are valuable to healthcare professionals facing emotional and psychological difficulties. But the goal should be to constantly normalize it, the same way we would expect a healthcare professional to take care of their physical health, see a cardiologist, see a neurologist, see their family physician, get blood work. Their mental health shouldn't be valued any less. And I think that, as we see this change, we also need to see not just resources to support our staff and our employees, but also actual changes in our expectations from employees, right? Creating flexible schedules for healthcare workers, structuring shifts in a way where it makes more sense. Should you work longer hours a few times a week versus short hours every day? And assessing what makes the most sense for each individual and being flexible. This allows healthcare workers to tailor their schedules to better align with their personal and their familial needs. And you'll get more from that individual in terms of quality of care and output if we actually listen to what works for them, as opposed to being deaf and expecting them to give you above and beyond. And this is critical because if long and inflexible working hours are the norm, we're just going to see more and more burnout. So we really need to be proactive in supporting our healthcare workers to thrive in their work environment. To wrap up this conversation, I want to highlight that burnout affects nearly half of all medical students and trainees, and it harms the well-being and resilience of our medical workforce. It is very real, and negative consequences on physician and provider and clinician mental health, as well as patient outcomes and quality of care, is something we need to monitor and be aware of. And individual doctors must work to improve their own resilience to burnout via positive coping skills. Some of the stuff we discussed today, we really need to empower them to take it on themselves to make sure that they're putting themselves first. And we also need to increase our expectations from medical institutions, and they must make structural changes to better support our doctors and medical trainees to incentivize self-care and make it a norm. All right. Well, thank you for joining me, and I hope to see you on our next episode. you for listening. Please follow us or subscribe wherever you get your podcasts. Please follow us at Mindful Care and at TikTok Psychiatrist for more, and don't forget to rate and review.